Eating disorders describe illnesses that are characterized by irregular eating habits and severe distress or concern about body weight or shape.
Well, I'm a dietitian, and a lot of times people that suffer from eating disorders are struggling with eating, whether it be restrictive eating or maybe overeating and then purging. And a lot of times their the first person that they may contact, or a lot of times it may even be if it's a child or a teenager, it might be the parent, is the dietitian.
Today, at least 30 million people of all ages and genders suffer from an eating disorder in the U.S. Individuals with eating disorders constantly see themselves as being overweight and never skinny enough. Nearly 116 million adults diet at any given time, representing about 55% of the total adult population. In addition to adults, according to Time magazine, 80% of all children have been on a diet by the time they've reached 4th grade. 35% of normal dieters progress to pathological dieting, and of those, 20 to 25% progress to partial or full syndrome eating disorder sufferers. Eating disorders can be found in both adolescents and adults. They can develop during any stage in life, but typically appear during the teen years or young adulthood. While 86% of people report onset of an eating disorder by age 20, 10% report onset at 10 years or younger. Eating disorders commonly coexist with other conditions such as anxiety disorders, substance abuse, or depression.
For some reason, anxiety, depression go along a lot of times with eating disorders. People that have bipolar disorder, and we've even seen people that have been abused in younger years. A lot of people that suffer from eating disorders do have it is a mental illness in itself, but there's usually something else that goes along with it. And a lot of times it's anxiety or depression. It's manifesting its way in that I can't control this, so let me control what I eat. One of them is an anorexia nervosa, which is an extreme restriction of food that can be, you can see people maybe losing a lot of weight, some significant symptoms that might occur over time, reduced heart rate, stress fractures, females, they might not have their periods anymore. Weight loss, of course, not eating, maybe playing with their food, skipping meals secretly. They really don't, publicize it. It might be saying I'm going to be vegetarian, or trying to, come up with reasons not to eat.
The primary concern of people with anorexia is the intense fear of gaining weight. Anorexics spend nearly 70 to 85% of each day thinking about food. This disease has the highest death rate of any psychiatric illness. In fact, the mortality rate associated with anorexia nervosa is 12 times higher than the rate of all causes of death for females 15 to 24 years old. Studies show 5 to 10% of anorexics die within 10 years after developing the disease, and 18 to 20% will be dead after 20 years. Of these deaths, 1 in 5 anorexics die under suicidal conditions.
Disorders can be fatal. In fact, anorexia nervosa is the most deadly mental disorder of anything else, more than schizophrenia, more than any other mental health condition. Then bulimia is where bulimia nervosa is really where someone will actually overeat, binge. And a binge is kind of identified as eating more food at one time than would be typically eaten by the average human, and doing that several times a week for a period of about a month at least. So it might be at night someone binges on, potato chips, or eats a whole bag of chips, or maybe goes through the drive-thru at McDonald's and has 3 burgers. And then with bulimia, they're purging somehow. It might be self-induced vomiting. It could be using laxatives, and it might be just over-exercising. But whatever it is, they're finding a way to try to make up for that excessive intake. Symptoms of bulimia, sometimes dentists might pick up on it, because if you've been making yourself vomit for a long time, the enamel starts to come off of your teeth. It can result in significant digestive disorders.
Like anorexia, people with bulimia nervosa also fear gaining weight. After overeating, bulimic individuals engage in some form of purging or other extreme behavior in an attempt to avoid weight gain. Most patients with this syndrome report self-induced vomiting, abuse of laxatives, fasting, or exercising intensely. 1.5% of American women suffer from bulimia in their lifetime.
That we talk about is just plain old binge eating disorder. It's actually more common than the other two, but it's just not as well known. And people just overeat, but they don't really purge. They don't do what the bulimia nervosa individuals do, and you might see the binge eating disorder is more commonly seen in people that are overweight.
Binge eating is one of the most widespread of all eating disorders and affects 1 to 5% of all Americans. Binging is experiencing a sense of lack of control while eating an overly large amount of food in a short period of time. 50% of individuals with this disorder inherit it genetically. Obesity is a common result amongst binge eaters.
The media today can be very dangerous, really, because we see pictures of people wanting to be thin and how everybody's trying to lose weight and diet, and we see models and everything. So media really has played a role over the years of people developing eating disorders.
In the U.S., eating disorder treatment ranges from $500 to $2,800 per day. On average, a month of treatment costs around $30,000. This monthly charge is costly considering most individuals need anywhere from 3 to 6 months of inpatient care. Only 1 in 10 individuals with eating disorders receive treatment. Eating disorders have the highest mortality rate of any mental illness. Every 62 minutes, at least one person dies as a direct result from an eating disorder.
And really, people are using food as a way to deal with their emotions or to deal with something in their life that's not really going as well as they would like for it to. It's really what eating disorders kind of boil down to.